Welcome, everyone. At this summit, you've heard a lot about longevity already and a lot about the people working on longevity. And my objective is to tell you a little bit more about why we're actually doing this. Why is now the time to work on these innovations? And if you remember, for many centuries, humanity has been seeking the fountain of youth. And there were a lot of claims over these centuries about finding this fountain of youth in whatever procedures and therapeutics that you could think of. But now we're actually at the time where about 30 years ago, people started to really understand the genetics and the molecular drivers of aging and were able to effectively enhance health span or lifespan in a variety of organisms, starting with worms, yeast, but eventually mice, which is a mammal, which is not a human, but still close enough to believe that it might also translate to humans. So when you think about what that would look like in a mouse, you see that mice at the same age, one would be almost looking like they would have to go to a retirement home or even beyond that. But the same age mouse, if it is treated with one of these novel treatments, looks completely useful and also has a much better function and activity. So when we think that that is possible in mice, why don't we believe that it would be possible in humans? And in fact, we already have drugs in humans. One example is metformin. A lot of you may also have heard of other drugs that are available that have a lot of these beneficial effects. For instance, the Wegovys, Mounjaros, and Ozempics. And we know that these drugs have a benefit on people with diabetes, but they also have a benefit on people with obesity, cardiovascular disease, and cancer. And metformin is a drug that has already been used for several decades. We know it's very safe, and it has been shown to extend lifespan in mice by 7%, which is something. There is a clinical trial currently ongoing, or will be ongoing soon, hopefully, that is testing the benefits of metformin in humans, and testing whether it indeed can prevent diseases of aging. This trial is estimated to cost $75 million US dollars. The good thing about metformin is it's already been available for a long time, so that makes it fairly easy to test. The problem with drug development is that it's very complex, lengthy, and expensive. And you have a very high risk in developing these novel drugs. So if you are to develop a completely new drug, it will take more time, more funding, and there is a risk that it might not work. However, we know that there are other drugs that are already available beyond metformin that can enhance lifespan. So there is a really good start for us. One example that is much more potent is the drug Rapamycin. Rapamycin is a drug that's currently being used in humans that are very sick and are receiving organ transplants. However, in animals, we've seen that this drug extends lifespan up to 26%. The challenge is that in humans it has side effects, at least at the dose that has been used. So what we need to do is we need to optimize rapamycin to not have these side effects. And so the estimate for this development would probably be around tenfold of the other drug that's already been used. So say estimated 750 million. And that's just one example that seems to be very powerful. When you think about other drugs that have already been shown to extend lifespan in animals, in mice, robustly, you see a long list of drugs with significant lifespan benefit. And these are drugs that we already have at our disposal right now. And thinking about the lifespan extension that you can show with these drugs that are not even being developed for longevity. They're just there already. Thinking about the potential of drugs that are being specifically developed for longevity. People may have heard about senescent cells. If you remove them, you see a tremendous increase in lifespan in animals. Cell-based therapies really have high potential. And another topic that's very hot is epigenetic reprogramming. We don't know yet how big the lifespan extension from these therapeutics will be, but it will certainly be in the range or even higher than what we've seen before. So what a lot of the people in the space are now working on is finding new therapies that are really targeting the underlying mechanisms of aging and focusing on these mechanisms to develop novel therapeutics that have even higher potential for health and lifespan extension. And that's what a lot of the funds in the space are working on. That's what the new version or the future of healthcare will look like. And that's what we are in the field all excited about. So thank you. And if you want to connect, here's a QR code. Hopefully you can find me on LinkedIn, and looking forward to questions.
Thank you so much. Would you give some examples of the companies you invested in?
Sure. So one example is actually, as you see in Rapamycin. Rapamycin is one of those drugs that has the most robust benefit in mouse lifespan. But we know that it has severe side effects in humans. And while a lot of people are already taking it just because they believe that they will be helped by, or that aging will be prevented by rapamycin, they're dealing with the side effects. So what we are now investing in is one company that's making a safer version of rapamycin, basically engineering out these negative side effects, but boosting the beneficial effects on longevity. And if you can't find something like that, then you have the market potential of a true anti-aging or longevity drug. What is it? So the question is, what are those negative side effects of rapamycin? Right now, it's being used to suppress the immune system. So you have, we don't know if you're giving it to a healthy person, what it would do to their immune system. Right now, it's being only used intermittently to prevent these effects. But even intermittently, people who are taking it, they get mouth sores after taking it. In some animal studies, you also show that the glucose metabolism is a little bit deregulated. So you don't want to have these negative side effects. And in order to do that, we have to out-engineer some of these signaling effects.
How do you get funding when at this stage it's such kind of a double-edged sword?
So the funding for this company is actually coming from biotech venture capital funds. So we raise funding from Sofinnova and Venbio in the Bay Area because they see the potential of the drug and they see the potential of having a safer version of it. So currently, for all of these therapeutics, you also have a clear path to developing them for existing diseases. So there's a rare genetic disease that responds to rapamycin treatment, but the patients cannot take it for a longer period of time because they suffer from the side effects. So they need a safer version. And so the investors see that potential and invest in it for that reason, but they also see the upside that it will not only help these patients, it will actually help keep people healthier.
Thanks, Alex.